Apple cider vinegar for weight loss. Drinking apple cider vinegar is an extremely effective way to lose weight. The fact is, it helps to lower your blood sugar and cholesterol levels, and it also improves your digestion. Plus, you can be assured that it is safe to drink. Lowers cholesterol. If you are trying to lower your cholesterol, apple cider vinegar is an ingredient worth considering. The vinegar itself contains acetic acid, which is a compound that reduces cholesterol levels. It also has antimicrobial properties that can help keep harmful bacteria away from salads. Vinegar is also a good choice for people who need to lose weight, because it can help reduce blood sugar spikes. And it can also decrease triglycerides, a type of fat that can increase the risk of cardiovascular disease. However, it is important to take care to drink apple cider vinegar in moderation. It can cause problems with your stomach if you are already suffering from digestive issues, and you should not drink it more than once or twice a day. You should also consult your doctor before you start drinking it. Apple cider vinegar is a common ingredient in food flavorings and preservatives. It can be consumed on its own or mixed with other ingredients such as olive oil and orange juice. According to a study, it can improve your insulin sensitivity, which helps control your blood sugar. This may not be the case for all diabetics, but it can help. Another study found that it lowers blood pressure. It works by inhibiting the enzymes that break down starch. ACV also contains pectin, a fiber that attaches itself to cholesterol and removes it from the body. It is also a good idea to make sure you drink plenty of water to maintain a constant flow of blood to your heart. Not only will this lower your blood pressure, but it will also help keep your heart working at its best. It may seem counterintuitive to add apple cider vinegar to your diet when you are looking to lower your cholesterol, but it is a safe addition. Lowers triglycerides. Several studies suggest that apple cider vinegar for weight loss has the potential to reduce cholesterol and triglycerides. However, further research is needed to confirm these findings. The effects of vinegar on blood sugar and insulin have been shown to be beneficial in mice. It is thought that these effects may be related to the way that vinegar affects the transport of glucose into the cells. Studies have also shown that vinegar can improve insulin sensitivity. This might be a key reason why it has been shown to lower triglycerides. A study done on type 2 diabetes patients showed that consuming vinegar improved their insulin sensitivity. In addition, it decreased their triglycerides and blood pressure. Similarly, a French study found that rats on a high-fat diet that were given vinegar had a lower rate of triglyceride formation and reduced weight. Researchers suggest that the effect may be related to the activation of the AMPK pathway. An in vitro study suggests that vinegar has the potential to treat potentially deadly bacterial infections. Another small study showed that it can help to increase good cholesterol levels. There are some risks associated with ACV, so it is important to consult your doctor before incorporating it into your diet. Those who have allergies or are taking diuretics should not consume it. It is also recommended that people who have diabetes avoid drinking large amounts of it. For example, a teaspoon of ACV before a meal is suggested. While vinegar can be used to control blood sugar, it is not a good replacement for a healthy lifestyle. As with any home remedy, there are some risks. Some people have reported experiencing tooth enamel erosion. Lowers blood sugar. There is an increasing body of evidence that apple cider vinegar lowers blood sugar. This is due to the acetic acid, which slows the conversion of complex carbohydrates into the bloodstream. In addition, a component called disaccharidase breaks down complex sugars in the small intestine. The vinegar may also have antioxidant properties. However, there are no long-term studies that confirm the effectiveness of apple cider vinegar in lowering blood glucose. Rather, the benefits are more confined to short-term effects. It's advisable to consult a physician before making any changes to your diabetes diet. One study in particular examined the effectiveness of vinegar on weight loss. A team of researchers compared the vinegar's weight loss effects to those of other commonly used substances. While the results were not conclusive, there was some evidence that vinegar did, in fact, help to reduce body fat. Another study looked at the effect of vinegar on postprandial hyperglycemia, which is the increase in blood sugar levels that occurs after eating. Researchers found that a vinegar-based salad dressing reduced postprandial hyperglycemia, in some cases, by as much as 25%. Finally, a small study showed that vinegar can lower triglycerides, the fat in your blood. But more research is needed to fully understand how vinegar works. To drink apple cider vinegar for weight loss, mix 2 to 4 tablespoons of the beverage with 2 cups of water. Diluting the mixture in this manner will make it less irritating to the skin and scalp. Overall, apple cider vinegar is a good addition to your diet. Taking it at the right time can also help to curb your appetite. As for the best dosage, the recommended dose varies from 15 to 30 milliliters of the vinegar per day. Helps digestion. Apple cider vinegar, ACV, has been used as a home remedy for stomach ills. It is believed to contain antibacterial and antiviral properties. In addition, the vinegar may have an effect on blood sugar levels. However, research into the use of ACV as a weight loss aid has been limited. Most of the studies looked at small groups of people. This means results are less applicable to the average population. However, a small study did find that drinking apple cider vinegar can help reduce cholesterol and increase the amount of good cholesterol. Another study found that it can also lower triglycerides. If you have diabetes, you may want to consult with your healthcare team before using ACV. Some drugs and diuretics can interact with it. Also, avoid taking full-strength vinegar. Unless it is diluted, it is too strong to be consumed without medical supervision. Apple cider vinegar may be helpful for people with type 2 diabetes. Research suggests that it can lower glucose levels and oxidative stress, 2 factors associated with the development of chronic disease. Although it has been studied on a very small scale, there are still many questions about its safety. One concern is that too much ACV can interfere with kidney function. Those with a low potassium level should be careful. Taking a high dose of apple cider vinegar can lead to hypokalemia, a condition that can cause bone weakness. Studies show that the acetic acid in ACV can decrease the potassium levels in those with diabetes. Researchers suggest that ACV can also play an important role in the digestive process. In addition to being a weight loss aid, apple cider vinegar can also help prevent infection and improve the lymph circulation. This can benefit both the diabetic and non-diabetic populations. Side effects. Taking apple cider vinegar for weight loss may help you burn fat, but it is also possible to experience some negative side effects. While research shows that consuming ACV may benefit many people, it's not for everyone. In fact, some people experience unpleasant digestive symptoms when they drink it. The most common side effect of taking vinegar is indigestion, but it can have more serious consequences for certain people. It can also interact with some drugs and diuretics. So, it's important to consult your doctor before experimenting. Apple cider vinegar has been used as a health remedy for centuries. Studies show that it can improve cholesterol and lower triglycerides. However, there are no conclusive studies on the long-term effects of drinking vinegar. Several studies have shown that consuming apple cider vinegar can delay gastric emptying. This can lead to bloating and heartburn. Moreover, it can slow the absorption of nutrients into the bloodstream. Some healthy people may not be concerned with this, but it can have significant negative effects for type 1 diabetics with gastroparesis. It's also possible that a slowing of the emptying of the stomach will have an adverse effect on blood sugar management. Diabetics with this condition have difficulty timing insulin in their meals. That's why it's critical to know how much time is left before a meal is digested before drinking apple cider vinegar. Aside from the negative effects of indigestion and increased levels of cholesterol, apple cider vinegar may interfere with some of your medications. For instance, it can increase your sensitivity to insulin. Also, it can decrease your body's ability to absorb potassium. You should also be careful with apple cider vinegar if you have high blood pressure or kidney problems. These conditions can make it difficult to control blood pressure and can cause severe health problems.